Welcome to the hybrid room at Terrebonne General Medical Center in Houma, Louisiana. This is part of the Cardiovascular Institute of the South. We're going to do a TAVR valve today using the JC Medical new J valve for aortic insufficiency. In the room, I have my partner, Dr. Prejean. I'm Peter Fail. We have a great tech. We got Dwayne in the back. We've got Tony. We've got Jared. We got Sam. We got Dr. McCullum, our surgeon. We got Elise. Who else we got here? We got Daryl Soleil. He's our echocardiographer. Let's go through the case here, Shane. Next slide, please. These are our disclosures. Next slide.
All right, so this is a 72-year-old male presenting with worsening exercise intolerance and dyspnea on exertion. Baseline echo did show severe aortic insufficiency. He had a history of head and neck cancer with prior resection and radiation treatment and chronic kidney disease. Next slide. So the patient was evaluated by the local heart team. He was found to be at high surgical risk given comorbidities of his cancer and prior radiation along with chronic kidney disease and would be best served with a TAVR. Therefore, we enrolled him in the J-valve study. So at baseline, his echocardiogram had 3+ AI. He had a regurgitant volume of 48 and regurgitant fraction of 47. His ejection fraction was preserved. So at this point, I'm going to actually break off to Dr. Soleil, who's our cardiac echocardiographer, to see what we're seeing today in the cath lab.
Well, thanks, Shane. So the parameters and things that we're measuring today are very similar to what we measured in the screening echo. And so you can see here at the LVOT view, the findings here, just looking at the color jets, more consistent with probably moderate to severe aortic insufficiency. I'll come down here to the on-FOS view. You kind of see the origin of the jet, kind of split right between kind of the, right in the center of the valve essentially, but more so kind of between the coronary, non-coronary cusps.
All right, so the patient underwent coronary angiography prior to TAVR, and he had mild coronary artery disease, 30% disease in the LAD, upper limit of normal in the LVDP. Next. He underwent TAVR CT. We got a perimeter of 80, and he had adequate coronary heights. You can see the RCA was 14, the left main was 19. No calcium at all in the valve. These were the iliofemoral vessels, and he had good iliofemoral vessels, no significant stenosis or calcification. You can see the angle on there.
Yeah, it looks like 14, caudal 2.
All right, next. So the J valve comes in 5 sizes. You can treat a perimeter from 57 to 104, so a nice wide range of valve options. He measured for a 28 millimeter J valve. Next. So we chose a 28 millimeter valve. You can see the height of the valve is 22 millimeters, so it's a nice low profile system. It's intravalvular. This helps preserve coronary access, and even in a 72-year-old patient thinking about the lifetime management of valves in the future. In summary, so we have a 72-year-old male with severe, moderate to severe AI, worsening dyspnea on exertion, found to be at high surgical risk, so we're here for a TAVR with the J valve. 28 millimeter J valve system is planned from the right transfemoral approach.
Excellent, excellent. All right, so we're going to put in the dry seal. We're going to cross first. You want to cross with the pigtail?
Yep.
And then switch out to a small safari. And then once we get that up, we'll put in the dry seal. So the valve at this point doesn't come with its own sheath. You have to put its sheath in. So we're going to use a 22 French dry seal to enter the valve or get the valve in. Excellent. We already have our pacemaker in. We already have our pigtail in from our left radial. All right, excellent. All right, we got the valve ready. We're across. We got pigtail. We got pacer in. Pacer's been checked already. You guys ready for the valve?
Ready.
All right. Mm-hmm. Mm-hmm.
I have wire.
Not yet.
Okay, we're going to deflect.
No,
No.
we're not going to deflect yet. So
Yep,
we'll go
not yet. We'll let it come around. There we go. Nice.
Okay.
All right. Can you pull your probe up just a little bit?
Certainly.
All right. Now we're going to deflect a little bit.
You have 3.5 turns.
1,
So
2.
this valve has a built-in deflection system, so
Yeah.
the sheath is steerable,
Yeah.
allowing for
3
more root angles.
and a half. All right. I like that. Give just a little puff there. Get a sense of where our valve is. Yep. Perfect.
Yeah, we're a little deep. We
Yep.
want to be right above that pigtail.
Yep. Yep.
With that radial pig, right where the pigtail starts.
There we go. Why don't we come up a little bit so that we have a little bit of, there we go. Keep going a little higher, and then now come in a little bit. So there we go. So we're basically in the outer curve. Yep, right there.
Okay.
All right. So we're going to go ahead and push the yellow forward.
So what we're gonna do is let's hold white in the back, and then we want to advance gray forward, and we just want those anchor rings to get exposed. Right there.
Right there. There we go. You can see that. Perfect.
We'll wait there for a little bit and let those warm up.
Yep.
You can see them expanding. Now we want to fixate gray and white in the back,
Mm-hmm.
and we just want to go forward with yellow.
Come back
Slowly.
a little bit. We did get a little deeper there.
Yep. Yep. Kind of pull back. There we go.
Right there.
How about there?
Go ahead and keep advancing slowly.
What do you think? All right. It's kind of nice how those things come into the cusp like that automatically, which is really nice. Self-aligning. That's close. Give me a little cranial. Let's see what happens when you do a little cranial. Yep, right there. Perfect. What do you
Nice.
think? That
think
looks
that-
more coplanar
I
right
think that
there.
looks
Yeah.
good right there.
Yep, I agree. All right.
So now let's advance.
Advance.
Let's see where that
System
pigtail's
a little
at.
bit.
Give it a little puff.
Yeah, let's advance the anchor rings a little bit more. Just the yellow.
Mm-hmm.
Nice.
You think that's far enough?
Yeah, you can keep going. The anchor rings.
I think I'm maxed here.
All right.
Yep.
Now let's go down.
Go ahead and push.
Just push forward.
So
the
let's
entire
come
system.
back with the gray just a little bit, and all we're looking for are those anchor rings to bow in a little bit. Come back with gray. Perfect. That's nice.
There we go. So it's definitely on the left cusp there. You can
Yep.
see how it's cut.
And now let's come down with gray and keep that thumbs width in between the yellow.
Mhm.
So yep, keep a thumbs width in between the yellow and the gray, and keep coming.
Bringing the valve down. What do you think about there?
That looks good right there. So let's go a little bit more with gray. Right there.
Bigger thumbs.
Yeah.
All right.
So now we can do a shot. Let's see how we look with depth.
Let's get ready to cine
Go ahead
this.
and save that image.
Let's go ahead and cine this.
All right, ready?
Oh, yeah.
Nice. So what we want to do here is we just want to advance the delivery system, the whole thing together slowly. Let's go live and do that.
Laura?
Okay, we're gonna advance.
Yep, the whole system. Yep. There we go. Nice.
All right.
Let's do a shot there and see how that looks.
Ready? Mm-hmm. Now, do we want our left ring further out?
So let's advance it a little bit more,
Yeah.
the
Uh-huh.
whole system. Like we did, just put a little
Going
bit
a
of
little
pressure.
bit more.
Yep, just the whole thing.
There we go. There we go.
Nice.
We just
nice.
had splaying of the rings.
Yep.
Yep, yep,
The left cusp.
yep. I think so. I like that. And then we're already in the right and the non very. It looks like we're in the non pretty nicely. And the ring. Sorry,
2,000 more, please.
please. All right. What do you think?
Let's do another shot here to confirm the depth and see
Okay.
how it looks.
One more. Mm-hmm. Still a little. I think we're still a little off the left, aren't we?
Yeah, I mean, we are a little bit. Let's, what we can do is let's pull that wire back and see what that does with the left.
All right.
There we go.
I like that better. Yep. I think it comes down a little. Yep. I like that. Comes a little bit more to the curve.
Yep, let's take a shot there and see how that looks on the left now. See if it opened up a little bit more, taking that tension off the
Okay, we're
wire.
going to take a shot here.
Yeah. Still seems a little
Well
bit.
seated on the right and the non.
Yeah. I think we definitely have the non and the right very well seated. I think it's the left I'm a little bit concerned about. Seems like
Yeah.
we're favoring the non a little
Yeah.
bit more.
Let's
Let
pull.
off.
Let's pull. Yeah. Let's pull the system back just a hair. Take a little bit of tension off the system. Yeah.
There you go.
Off
There
the
you go.
greater curve. Yep.
Yep.
There we go.
There we go. Yep.
Nice.
I like that better. Okay. Is that you? Go ahead, Flora, again. Yeah. Okay. Excellent. Okay.
And let's
Alright,
do a
nice.
coplanar shot there. I want to see how that looks on the left to confirm
Let's
it
do
after we did that.
one more time.
Ready?
Taking that.
Better, but still.
About as deep as you can get.
I agree. I
Yeah.
don't think we're going to get any deeper.
No, it looks good. I say let's look on echo and confirm on echo to see how.
Darryl,
it
what do
looks.
you think?
Yeah, that's what I'm looking at right now, just kind of explaining across.
Okay.
And that position actually looks very good.
Can you see all the wires? Is it possible to see the nitinol wires into the
Yeah.
cusp and how far down they are?
That's a little bit more challenging. Let's see, I can see wires there.
Yep.
Come around the other side.
I think you're down. The left cusp is the one I think that bothers me the most as far as placement of the wire. I think the other two are well placed.
Yeah, so the right cusp, that looks okay there. Coming across the non-coronary there. Left cusp over here.
Is that the left I'm seeing on the right-hand side?
Correct.
Okay. Oh, the wire definitely.
Yeah, I think they're pretty.
You know, it's
Well seated
it
on
well
echo,
does.
at least.
Yep. No, you can see it coming in and out. All right.
So let's just pull the valve back just a hair.
Okay.
So the valve is gray, just a hair.
What do you think?
I think that's good right there.
Okay.
Let's check that.
We're going to take a shot.
Yeah.
It looks like we missed the left there.
Yep. I think it definitely came off.
Yep.
All right.
Okay.
Plural.
So let's pull the whole system back slightly.
Okay.
So
Pull
with
the whole system back now.
yep, just a hair. Yep, whole
get it?
wire. Yep.
There we go.
All right. Now let's advance slowly.
Okay.
Let's stay right
Letting
there.
those flare a little. Okay, we're going to advance.
Yep. There it
Maybe
goes.
get a little bit more wire out.
Yep.
Help me in.
Nice, nice, perfect. All right, let's advance that slowly.
Okay, that's seems to be seated now. I've got some bowing on the
Yeah.
cables.
Let's pause right there.
We're gonna
Let's take a shot. Yeah.
All right, we'll go ahead and take a shot here.
Let's just hold the system where it's at right here.
Okay.
And let's just pull gray and yellow. All right, now let's advance. Now let's advance forward together, slowly. Both of them. Let's stop right there and
Okay.
let's look at that. See how that looks.
Little puff.
We're going to take a shot here.
Still not grabbing that left.
So let's bring the whole system up
Okay.
together.
Okay. We're bringing everything
Slowly.
back.
Yep, slowly. All right, and let's put on another turn like you said, like you recommended. Let's go another half a turn with deflection.
All right. We got a half a turn on.
Okay. And then,
Now let's slowly advance.
There we go.
That looks
Yeah,
better.
that looks
Yep.
better.
Nice.
Yeah, that looks better.
Nice.
Yep.
That looks really, really good right there.
Yeah, I think
We'll
that
just
did it.
save that.
Let's do a. You got that? Let's do a shot there. Make sure we grab that left cusp.
All right, taking a
Ready?
shot here. Jack?
Oh,
Yeah.
that looks really
Yep.
good.
Yep.
That looks
Yep.
really,
Yep.
really
No,
good
I
right
think
there.
we got that.
I think we look really good there.
Okay.
I think if you look at the right coronary cusp, we're pretty much at our 2/3.
Yeah,
Yeah, no,
we're
it's good.
definitely there.
It's
yeah.
good.
So I think
Yeah.
we're lined up, and I like the way the alignment goes.
Okay,
You agree?
I agree.
All right.
Looks good.
Ready to lock?
Yep, so lock in the back.
All right.
And then what we want to do is, yeah, we can pull the pigtail back now too.
Okay, the pigtails
Go
come
ahead.
back.
You get it?
Yep, and just look at underfloor. We might actually, yep, looks good.
You got it.
All right.
Good.
And now what we want to do is, remember, we just want to take gray off a canter, so you want to push that and just take it slightly off.
Mhm.
Perfect.
Okay, we
Got
have
good
good
capture.
capture.
Pacer off.
Pacing.
Let him recover a little bit there. I like it.
And the
Come-
next pacing run will be at 160.
And then remember when we
We
go
could probably actually, just try. Actually, I think maybe go to 180 because he really didn't
The
dive.
pulse
Yeah,
pressure?
yeah,
Yeah.
get his pulse pressure down a little bit. Go to 180, Sam. All right, is everybody ready?
And then remember when we take gray, we're going to turn it all,
All the way.
consistent. Yes,
Yep.
correct.
All the way. Okay, anesthesia, you ready?
Ready.
Okay, Sam, all right. Pacer on. Nice drop. Everybody likes it. We're deployed. Pacer off. Watch the rhythm. Nice recovery. Nice.
Nice.
Nice. All right.
Okay.
Go and cine that one time. We'll save that. That looks pretty. Nice. What do you think?
Looks good.
Yeah, I agree.
Good.
I agree. It was a nice implant. All right, now we got to take this thing out.
Yep, so before that, we're going to remove the anchor rings. So you want to release them. So you want to push, yep,
Yeah, this is one
push
of
yellow,
those.
and you want to turn that away from you slowly. Awesome. All right, so now we can see that so now we want to pause a little bit, and we want to make sure that those nitinol wires are back.
Mhm.
Yeah.
So we
looks
can
like
come back with the TE probe just a little bit.
Sure.
Thank you.
Thank you.
We're looking for the dark part of the wire to come
Yep,
back.
exactly.
And we can see that all of them have come back. So I don't see any nitinol wires down there. It looks pretty good from there.
I agree.
Now, before we do that, we want to unrelease the toggle.
Want to advance a little wire.
Yes, advance a little bit of wire and take out the flexion. Yep, come all the way back.
All right, we're all the way back.
All right. And now what we'll do is we can see that everything's released, so go get a little bit of wire and we'll pull the delivery system back slowly.
Okay, pulling back.
Nice, nice.
All right.
There we
Now
go.
what we can do is we can turn that gray completely towards us now. Just the gray? Correct. And now we can come back with yellow. So pause right there. Let's come back with yellow to gray. No, don't turn it back. So just keep that forward. Come back yellow to gray and come all the way back to white. And now we're ready to come out.
What do you think there, Daryl?
Yeah, that's an excellent result. So looking at X-plane here, LVOT view, and of course, and then the on-FOSS view, that looks great. Get a sense that there's just trace AI kind of coming over on one side there, but wow.
We
this
still,
is
yeah, we
really
still
good.
have we also still have the wire across too.
Okay.
So that may, are you central is what you're talking about? Or are you talking about perivalvular?
Just right along the edge there, but it's nothing significant, nothing at all.
Okay.
Yeah, I'll take a couple more pictures here.
Yeah, and we'll get ready to pull the wire back. We'll be able to evaluate that a little further.
Yeah, pull wire back, and then we can.
Nice. There you go. So the wire should be out now.
Okay. Oh, that's beautiful. Beautiful result. Yeah.
And I think that's it. Anything else we need to do? Daryl, we got everything out of the valve there, so it's all you for right now.
All right. Looks very, very good. Gradient about 5.
5? Okay. Excellent. Excellent.
So it looks like we got great valve depth. We have trace to no AI, and then a peak and mean gradient of 12 and 5.
I like that.
Very nice result.
Oh, that's an excellent result. Yeah, this is great.
Do we do a final angio?
We can.
Aortogram? Yes.
We can. Right through here.
We'll pull the TE probe
Pull the
back
toe
one more
probe out
turn.
one more time, Daryl.
All right,
All right.
we're going to take a final angio here.
Last one. There you go.
Beautiful.
I mean, really nothing coming across. That's gorgeous. That is gorgeous. You know, obviously, thank you for joining us here in the hybrid OR. Hope we showed you something for one of the new technologies coming out for aortic insufficiency. I think, you know, it's going to be interesting because I think this is one of those things, you know, if you look at the history of valve disease we've gone through, we sort of ignored tricuspids for a while, and now tricuspids have become the hot item. And I'm going to wonder if this is a next, you know, we talked about part of the trial that we're starting to see more and more people coming in with moderate to severe AI that I think in the past may have been ignored. So I think it's going to be interesting to see how this moves
I
forward.
would completely agree. Since we started enrollment in this trial, it's we see when we're looking, we see more.
Yeah,
AI.
exactly,
And-
exactly.
And if you quantify by cardiac MRI and volumes, there's a lot more patients with severe AI
agree,
that are going around.
And I think a lot of times, you know, these patients, when they come to see us, they're when way down the spectrum, they're really sick. And so hopefully this technology will go forward that we can, you know, treat a lot more patients.
Absolutely.
Thank you very much for joining us.